Good evening, my name is Tyler Hall. I am a PTA at NW Orthopedic Outpatients and Sports Medicine. Tonight I'd like to talk to you about something that's going on today that doesn't really get addressed enough, and that's gender-based medicine. You see, I've been a PTA for about 2.5 years now. I have treated all types of people. I've treated black people, white people, Hispanic people, I've treated old people, I've treated young people. And the most, I want to say, challenging type of people to treat are those that don't identify as the same gender that they were assigned to when they were born, okay? So tonight I'd like to make a discussion for gender-based medicine on transgenders and orthopedic therapy, okay? Now first, in order to get a good understanding of my concern for the lack of adequate treatment towards these transgenders, I'd like to get a little more definition of what goes behind the term transgender. Now, everyone has a sex and everyone has a gender. So what's the difference? Sex is what you were assigned to at birth by a doctor, right? They look at you and they say, well, Billy, you're a boy, right? Because they see that you're a boy. And they look over here and they say, oh, Charlotte, that's a girl, because they see a girl, right? It's physical and they can see it. But a very common misassociation that gets interpreted at birth is that gender is connected to sex. And despite the studies that go behind it, and despite the scientific authority that disclaims this idea, gender is not connected to sex, right? Because gender is the way someone thinks, the way someone feels. It's the way that it is defined as the behavioral, cultural, or psychological truth typically associated with sex, but is not intertwined with sex, right? So you look at very common social terms that are refined by gender, right? Male, female, boy, girl, feminine, masculine, that's a very common one. So what happens is that someone is born as a certain sex that is assigned by their doctor, and they get told that they're a certain gender. Sometimes they grow up and think, hey, I don't want to be a boy. I think I'm meant to be a girl. Or, hey, I don't want to be a girl. I think I'm meant to be a boy. So that's what we have to do. So we have to figure out how are we going to treat people who don't agree with the type of sex that they were assigned to at birth. Okay? There are many differences between male and female. Okay? And there are many differences, both behavioral and biological behind the two. So we need to really address both in order to get an understanding of how to treat transgender individuals, okay? Behavioral differences between males and females is very common. It's how they act, right? Males are typically have more testosterone, more aggressive. They're not as perceptive to therapy. They're not as, they have more muscle tone, so they get more tight with everything. As females, they're more willing to interact with people. They're more willing to go along with the home exercise program, the plan of care. They're more in tone with emotions than male, right? Women also have been documented as being able to tolerate pain better than males. They've also been documented as having more of a success rate with therapy than males, whereas males, they tend to perform better. So that's an interesting quote that I saw in one of the news journals I researched. Males perform better in therapy. However, women tend to meet their goals. They tend to meet their MCID for their different type of tests that they have to take to assess their progression. So men and female are very different in that tone. So to treat one who identifies as a male, whereas to treat one who identifies as a female, in a behavioral sense, you have to know how to do both, right? So if you treat a male who's actually identifies as a female, how are you going to treat them? How would you approach that? Because not only are they differently by the way they behave or the way they act, they're also differently biologically. Okay? Now, like I said, they've got more muscle tone. Women tend to have more body fat than men. Of course, male testosterone get that aggressive behavior and everything. It makes them more perceptive to their muscles breaking down with exercise. And then there's other things to consider when treating males versus females. One, if you're treating someone who identifies as the opposite gender, let me give you an example. Okay, here's a very common one we have. If you treat someone who has a history that's more prone to one gender, it really affects how you're going to treat them, right? For example, let's say a woman transitions into a male and she wants to be identified as a male. Okay, that's the gender she assigns with. However, what if she gets pregnant? What would he get pregnant? There's a lot of therapeutic techniques you can't do in regards to that, such as E-stem, such as certain types of manual, certain types of core work. You have to know how to treat each one differently, right? So the main issue we see nowadays is that there is a lack of gender-based prevention, all right? Gender-based medicine, okay? And you go into research about it and you look into it, you see that there's a lot of different things between men and women that need to be addressed in order to treat transgenders. One, women receive less guidelines-based diagnosis and less invasive treatment than men for certain type of high-level diseases such as heart failure, and heart attacks. Women have an increased risk of stroke than men, right? You got to put that in consideration when you're treating them. Women are more likely to get diabetes than men. And also, it's a very common thread that women get less referrals for rheumatoid arthritis than men. What's that mean? That can relate to therapy is that if a woman isn't diagnosed with rheumatoid arthritis and we don't know about it, she could be over there doing a leg kick in pain and we could think it's something else. That is something that really hinders the optimal treatment we can give a patient. And that's something that needs to be addressed. And it also goes for males too. Males are more likely than women to have osteoporosis, which is a hidden cause for a lot of fractures in the shoulder, the neck, the leg. But the problem is that women are more known, based on their gender roles, to get osteoporosis. So when you treat them as a woman, when they're really a man, you get confused about how to treat them because you don't know they have the osteoporosis because no one's diagnosing them with it, right? Other mental statuses like depression play a role in it, but they're usually underdiagnosed. So the lack of gender-based prevention, management, and therapy and how it negatively affects treatment of certain transgenders. There's a great quote I read today. It said, gender medicine must consider the needs of both sexes. And that's why we're here, because we need to talk about the needs of both sexes in order to treat transgenders, right? Lack of data that goes behind certain diseases, like I said about the osteoporosis, like I said about the diabetes, about the heart failure, and returns to just men having it compared to just women having it. Okay. So we talked about how the lack of gender-based prevention and management can negatively affect someone. If you don't have all the information you need to treat someone who might be identified a different way that they're assigned to, they're not going to get treated the best way they can, okay? So there's quite a few approaches to gender-based care that needs to be considered, especially for orthopedic surgery, all right? A transgender patient of mine once said, she wants clues that those who work for me actually care about my community and the things that matter to me, okay? So what I believe needs to happen in orthopedic rehabilitation is that we need to have cultural competency training, okay? We need to learn how to treat people who of a different gender and of a different culture than our own, so they can feel like they're getting the care they need. When we write our notes, we need to make sure we respect the individual. We don't violate any protected transgender rights, okay? You gotta watch the pronouns, okay? when you first treat a patient, ask them, like, what do you identify as? What were you assigned to? What do you want me to call you? Okay? What that does, it allows that individual and that human being to take ownership of what they want you to call them. It gives them that power that they need, right? Understand gender assignment at birth when we're doing evaluations, okay? Like I said before, if they're more prone to certain types of cancer, they're more prone to certain types of heart disease and bone disease, that can negatively affect the kind of care they're getting if we're not exclusively asking about these. Okay, have an open dialogue with the transgender patient, okay? Ask them about the gender identity, like I said, and respect their answer. Respect them for what they want to be called, treated, whatever they want to be, okay? We're here to treat them. We're here to make them better, okay? Okay, and when you do an evaluation, you shouldn't ask them what you need to know to treat them best, okay? Like I said, ask them the identity at birth, okay? Ask them what sex they were assigned to at birth. Because the health conditions for men can be very different from women, and it really affects how we treat them. Okay, here's one, gender neutral bathrooms. Give transgender patients gender neutral bathrooms, okay? If it's gender neutral, no one has to feel weird about it. Don't have to get the government involved. Everyone's happy, right? And it respects them as human beings, right? You know, imagine going to somewhere where you go just to go to the bathroom and someone says you're not allowed to be here. Like it's a bathroom, okay? Just give them a bathroom. Here's a very interesting one. Now we talked about how to treat them on a human being basis, but what I'm more concerned about is how we treat them from a therapeutic basis, okay? Because I do love physical therapy, and I want to give every patient I treat the best care I can, okay? You got to do the best job you can. So, a very good point that I came across of today was you have to be aware of disassociated or detached body parts from transitional surgery. Transgenders, a lot of them get transitional surgery, okay? So, that can affect us as manual therapists, how we treat them, okay? We might have to be careful around the chest area. We might have to be careful around the groin area. We might have to be careful about how we move certain body parts that are stiff from scar tissue from the surgery they just got, okay? Because you hear it in therapy, right? They teach you in school. You want to treat the whole program, holistic treatment, right? Treat the whole person, holistic treatment, right? So treat the whole person, okay? For example, women tend to have more of a lordosis in their pelvis, right? Someone who just went through a certain surgery to get that genitalia taken care of, they might even have more scar tissue. They might have even more of a pelvic torsion going on. You got to know that when you're treating them. That way you can treat them, because the pelvis, if this is messed up, it's going to affect the entire body. Okay? So you have to know that what's going on behind scenes in regards to their transition into whatever gender they are. Another good example is scar buildup from breast removal that affects movement in the cervical spine and your shoulders and your scapulothoracic joint back here, okay? So if they're here to say, well, my shoulder's hurting, and they just transitioned from a woman to a man, then they're going to have a lot more extra scar tissue in there. It's going to affect the bursa, it's going to affect the acromion, it's going to affect the nerves, that's that thoracic outlet going on there. You have to watch out for that when you treat these people. For men, it can go for men. Women that go for men, men that go to women. If a man transitions to a woman and she has low back pain, that can come from, genitalia surgery. They get stuff removed, and it can put them more to tight muscles here in the hip flexors, here in the adductors right here, in the pelvis and the pubis. It could affect the low back, make the low back pain increase. So when you're treating this person, you're thinking, well, I know that he had that transitional surgery, so that could really affect his low back pain. What muscles do I have to stretch? What muscle energy techniques or passive stretching or joint mobility do I need to do to make him feel better so he can get more movement in that spine and restore those ligaments, right? Okay, so like I said, holistic, treat the whole patient based on his or her history and consider their past medical history. And probably the most important thing that I have studied is that you do not judge someone based on what they do, okay? Everyone has their own life. Everyone does whatever they want. If someone decides to transition, that's not our job to jump in there and tell them what we think. We treat whoever comes in front of us. We do it the best way possible. We meet their behavioral, we consider their behavior, we consider their biological, we consider their past medical history, and we treat that human being as a holistic person, okay? And that's important because everyone deserves to be treated the same. Transgender people are still people. We treat them the exact same regardless of what they're going through or what they think, okay? Well, thank you for having me. I deeply appreciate it. Any questions? No? Okay, thank you.